You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have an expert on the topic, probably Utah's busiest implant dentist. We've had him on the program before, Dr. James Willardsen. Dr. Willardsen,
Randy,
welcome to the program.
Thank you. It's good to see you again.
Now, you say nobody should be wearing a loose-fitting denture. Dentures are out.
Dentures are out. I don't know why you'd want to wear one. Yeah. They're kind of a thing of the past. There's lots of them out there, but it doesn't have to be that way. They don't have to live like that. There's more available to them.
Okay, now at the top of the show, I even said, your center, Stubbs Dental.
Yeah.
You guys are the busiest
in
Utah.
So
according to the manufacturer, tells you that.
According to manufacturers, the number of implants that we place, we place more implants than anybody in Utah.
And we've talked a little bit off camera, but because of implant dentistry, like you have like a new love for dentistry.
I do.
Elaborate on that. What does that mean?
You know what, Randy? In my early career, it was cosmetics and there was also patch dentistry. It's kind of the way that we grew up. Silver fillings and all that kind of stuff, crowns here and there, and it's what my dad did. But dental implants, it's just changed everything. So instead of having, you were kind of confined to a bridge or a partial or something that was removable. Now we can actually put something in there that's fixed and it doesn't have to come out. It's the only way we can really kind of replace your teeth, so to speak.
How old can you be to get this done? Like, what's your oldest patient that got upper and lower teeth that didn't come out?
You know what? In their 90s.
Why would a 90-year-old want to do it?
You know what? It's a quality of life. If you think about it, these are the things that they get to enjoy now. They're not out running marathons. They're not out, mountain biking. They're with their families. They're going to Thanksgiving dinner, Sunday dinner, and they want to enjoy the rest of their life.
They want to eat.
Yeah, eating is so social. And so,
but a 90-year-old doing this, are they more likely to fall out?
No, that's the beauty of it.
Statistically?
Statistically, no. The bone is bone, and if it's taken care of and well kept, it can last. Yeah.
So this 90-year-old, I didn't let you finish, but what happened to this 90-year-old?
Came in, he was a denture wearer for many, many years. Thought that was his course in life. He was just gonna have to wear these floppy dentures. We were able to literally fix implants in his mouth and put teeth that stayed in his mouth. They didn't have to snap on or off or anything like that. And he was able to have teeth that
upper and lower?
Upper and lower, yeah.
Could they eat whatever they wanted? They got to take it easy.
No, he could eat whatever he wanted. There's a healing time, so we put him on a soft diet for a little bit.
Okay.
But once that's healed, corn on the cob, steak, juicy hamburger, you name it, he can do it. Yeah.
Now you brought a stack of photos, so we'll get to as many of those as possible. Okay. Now, Utah. Most people think of Utah as this, everybody's healthy. Yeah. Are there a lot of people either headed to dentures or wearing a denture in Utah today?
You know what? There's so many. You'd be shocked. I see it every day. People that are in dentures. You could fill a stadium full of people that have dentures currently, and people that are heading to dentures. One of the things you asked me earlier, who are these patients that need this? I see this all the time, Randy. It's patients like these mothers that they've been putting their kids in front of themselves for years.
Okay.
The kids needs braces. The kids, they're going to college, and they've always kind of put themselves at the end of the line, and things have just kind of caught up to them that now it's their turn. They have to deal with this or take care of this because they've got no other option. They're at a point of no return, and so they come to us looking for an answer, looking for some desperate help. And the beauty of it is we can help them.
And you guys do this every day. Like
every
good
day.
People. Is this true too? Somebody on the day of the procedure can walk in with no teeth.
Yeah.
And like a few hours later walk out with upper and lower teeth that don't come out.
The vast majority of our patients.
Is that rare or that happens a lot?
We do it all the time. It's very rarely do we have to say that this can't be done. It works out to where they can literally walk out with teeth that day.
Now correct me if I'm wrong here, but I guess how dental implant dentistry is done most of the time, like 90% of the time, is you go to one place where they do maybe the imaging center, then you go to another place where they do the surgery, another doctor that puts the teeth on top, and then they get them maintained elsewhere. You say at your office, you do that all right there. Is that why you do it so quickly?
We do. And you know what, Randy? I used to do it that way. And part of that, because I've been through all those frustrations, we knew we needed to do it different. We had to put it in-house. where they didn't have to leave the office. They could come in, have the surgery done, have the teeth done, have the lab right there, have the imaging right there. And the beauty of that is it saves the patient time and money. And so we're able to pass that on to the patient.
So I've looked at your prices, right? And we, I've Googled this, and I mean, you're in line or less than most people.
Yeah, right? Yeah, we truly do try to keep those costs down for our patients, and that's how we're able to do it.
And people are financing this. So, people always email us.
Yeah.
Because insurance, Medicare, Medicaid, even the best dental insurance doesn't cover it.
Yeah.
But like every day people are financing this?
Every day.
All the time?
All the time, yeah. And insurance can help to a point, but there's always extra costs.
So you're still going to kind of milk every penny possibly out of insurance?
Oh, we try to use as much of their benefit as we possibly can. Again, we're trying to benefit the patient. That's our main goal. We want this to be a good experience and a pleasant experience all the way through for the patient.
Okay, so I'm going to back up for a second. So you said you did a 90-year-old. So when a 75-year-old or 80-year-old comes in and they think they're too old, does that happen?
Oh, yeah, they think they are, but they're not. We can make it work. The beauty about that is we've done much worse. We've seen patients much further down the road, but we're able to put a younger patient into something even better.
Yeah, but for people wearing dentures, like if you've been wearing a denture 10 years, you don't have enough bone to do this. Is that right?
Not true. No.
Not true.
Here's the beauty of it, Randy. We can make it work. There's techniques, there's surgical, whether it's zygomatic implants, adding bone to the arch, we can make it work. That's the beauty of the technology we have now. With the imaging, the grafting that we can do, we can make anybody have teeth.
Now you're kind of like the leaders in all on four. That just means what? A full arch of teeth on what?
Basically, on 4 implants. That's kind of the common name that has become to known.
That's for dentists. That's what dentists call it.
That's what dentists call it. But really, what it is, it's just rebuilding an arch. Rebuilding a smile, giving that patient their teeth and their life back. And it's not even necessarily about their teeth. It's giving them their life. That's
really? I mean, their life?
Mother Teresa said this: "We shall never know all the good that a simple smile can do." Okay. And it's a societal thing, Randy. It's what it's our cultural thing, and it's worldwide. You can go into a country and you may not speak the language, but a simple smile, it can communicate so much.
Okay, that's fair. That's good. Yeah. That's good. Now, you brought photos.
I did.
What are we looking at? Let's take a look at some.
Let's talk about these. So here's a photo for Randy.
All right.
So I mentioned earlier, patients like this, they're these wonderful moms. They've been putting their lives out there for their children and for their families for years. And their needs have kind of gone to the back of the bus. They've had to kind of put things off for themselves, just for those reasons. Their values and their everything else was more important than them.
Okay.
And a beauty about someone like this is, she came in, there just wasn't a lot more we could do to help her with what she had as far as keeping her teeth. But the beauty with what we've got, we can actually give her something.
But on the before photo, her teeth don't look too bad.
But she didn't like them, Randy.
Okay.
She was unhappy with her smile. She was self-conscious about how she smiled. And not to mention there were some other things going on behind the scenes. There's some bacterial infections, other things that were happening back in the mouth that nobody else knew of but her. And in the back, she couldn't chew. She was having trouble eating. There was pain. There was just things that were going on behind the scenes that she wasn't going to tell people about, anybody but her husband.
Okay.
And so, and so the option was for her. To everybody else seemed to be a denture, but we knew that we could do something different for her. So what we did for her is upper and lower teeth that don't come out.
Looks good.
Yeah, she loves it. She's a sweet lady. I love her.
What do they like more, the way it looks or what they can eat?
That's a great question. I get patients all the time. They come in and say, "Oh, I just want to eat. I just want to eat better. I don't really care about the looks." And it's funny, Randy, because they come in, we do this procedure, and down the road when they come back in for follow-ups, they tell us about the compliments they're getting.
Okay.
And that becomes kind of the drive from there. In their lives, it kind of pushes them forward.
Even the guys? The guys,
it's great. You see their personalities. To me, what was different before, I think it was there all along, but they were just kind of holding it back because of the way they were feeling about their smiles.
You say their personalities change.
Well, so you bring that up.
Okay.
Let me bring up someone here for you. Here's a gentleman right here. So he came in, and this guy's a professional. I mean, he's such a good guy.
Looks like a happy guy.
Yeah, happy guy. He came in, and he was a little bit held back. I could tell, he just wasn't. He was a little bit more on the shy side. But then after we put these teeth in that don't come out, he just kind of opened up. He just kind of came in. He was funny. He was more sarcastic. And over the years, as I've gotten to know him, he's just more confident.
And that guy would have been wearing a denture in the before photo.
He would have been again, this is one of those, he wasn't happy with his smile. He didn't like the way it looked and the way he had presented himself. And so he was heading towards a denture. We were able to put something in that didn't come out.
It's very nice. And they can last as long as you take care of them.
As long as you take care of them, they can last for you. Yeah.
So no more dentures.
No more dentures. It really breaks my heart when patients come in, and don't get me wrong, patients come in and they ask for dentures. They do. And in our office, we're not just a, all on four only type of practice.
And for people just tuning in, all on four meaning upper and lower teeth, supported by 4 implants that don't come out.
Yeah.
Okay.
That's not all we do. I still put crowns on teeth. I still even do root canals from time to time. But so we can save teeth, and that's my job, is to try to save teeth when it's necessary and when it's needed, but there are cases like these cases where it's gone their teeth have gone the way of the world. It's time that they have to come out, and we do have some options for them.
Is this one of those things where they go, I should have done this a long time ago?
It's funny you bring that up. I've had patients tell me that so many times. I wish I would have done this sooner, because they've been living, especially dentures patients, they've been living with these dentures. The upper denture works okay. They can kind of get by, and a lot of these people, they're pretty tough. They're pretty durable. They may tell you, if you ask them if it's your grandparent or parent, oh, I'm fine. It feels okay to me, until they get in something that's secure, and it just changes things for them, because now they've got the confidence, where they used to have to kind of watch the foods that they ate. Where, when they're at a restaurant reading a menu, they had to kind of think, okay, what can I do here today with this, family member or friend?
Is that right?
Yeah, where it's not going to, my denture's not going to slip, or it's not going to fall out. Now their options are just, they're opened back up. They can live a normal life just like we're used to with our teeth. That's kind of taken away when they lose their teeth.
Now, what about the people that are afraid of the dentist? Because you guys are big on sedation.
Yeah, we do a lot
so
of
they're all
sedation.
numb. Everybody's numb, obviously.
Everybody's numb, yeah. So, and that's another thing, dentistry over the years has kind of had this reputation of, there's fear, and if you read the studies, people are afraid of the dentist. Well, the nice thing about sedation, it takes that off the table, because we can work with those anxieties in a way that they go to sleep, they wake up, and it's done. They don't have to think about that anymore.
So what are you monitoring? It's IV sedation.
It's actually, what we do is we actually have a nurse anesthetist that comes in.
Nice. Okay.
Yeah, so we've done the IV sedation, but we found that bringing on an actual professional nurse anesthetist that monitors everything from heart, oxygen, we're managing their airway in the most professional of ways. So normally, if you hear, conscious sedation, usually it's IV sedation. The doctor, the dentist, is monitoring the patient. And so they've got to kind of control what's going on in front of them in the mouth as they're working, as well as watch the patient, make sure that's being monitored.
Okay.
We've kind of decided to get away from that. While, yes, I am certified to do that, we really decided it's the best thing for the patient to have professional anesthesiologists, nurse anesthetists that come in. We monitor the airway. They're watching everything from the oxygen levels, their heart rate, all the things that need to be monitored.
Is this true that some people have amnesia, or they don't remember it?
They don't remember it. Yeah, so the medications that we can give, they don't remember anything from the procedure. It's if there's anything, it's like watching a movie. You might remember a snapshot, but you don't remember the movie.
I hear these stories where people are at home, they wake up on the couch, somebody gives them a ride home, and then they forgot that they even had it done.
It
Is that
happens.
true? Because that does sound like a little bit.
It's true. And
They look in the mirror and go, wait, how come I've got a great smile? Well,
Yeah. And they wake up and, hey, that looks great. The next day, I forgot that it even happened. So yeah, that happens all the time.
Good. And these patients, like they're compelled, you say, like to give you guys cards or one to try to give you a hug.
Oh, you know what?
Like you don't get that in other parts of dentistry, you said.
Yeah, well, here's the thing. The beauty about what I've been doing for the last several years, it's been the most rewarding part of my career, because I really am taking patients that they are on they've been dentally handicapped for so long, and they've pushed this off for so long.
Okay.
I'm able to now give them something that they thought was gone for the rest of their life. They really thought that those days of being able to bite into a hamburger and enjoy that with their grandkids or with their children.
That's good.
They thought that was the thing of the past. And when they do come in, I've seen grown men cry. They've had me crying because of the fact that, I've been able to affect their lives, and we've grown a relationship and a bond over that. And my staff, it's just kind of like family now. It's a great experience.
So this is the focus of what you do in the practice.
Yeah, it is. It's become the focus of what I do.
Good.
Again, like I said, I still do other things, but it's still, this is the main thing that I focus on in my practice. Yeah. So let me show you this next patient.
All right.
So again, this is a very typical patient, denture wearer for many, many years.
So he has no teeth in there right there. Okay.
And he really thought, I just need a new denture. Assuming, in his mind, I didn't have the bone, I didn't have, the necessary things to get implants. It's things I've heard many, many times. That they come in, they've lost their teeth, so they think they don't have the bone necessary to place implants. And it's great because we can go in with the imaging and the materials that we have now and the technology we have now. We can put the bone there if we need to, and we can place those implants. So he came in, he didn't have his teeth. We were able to show him how we could get him in teeth that didn't have to come out anymore. And it was just a life changer for him.
So they can eat like things like popcorn?
Yeah.
Nuts,
carrots.
Do they have to be
popcorn.
careful with like the front teeth, like biting into a carrot?
So yeah, the beauty of this, once everything's healed, you can eat just like you did with your teeth. Yeah.
Even things you're not supposed to eat, like ice cubes and
I wouldn't
open
tell
bottles.
you to go chew on rocks. Don't chew on rocks.
But literally, they're strong.
Yeah, they're strong.
Okay.
If you're going to break a tooth, you could probably break this, but yeah, you can eat like a normal human being again. Yeah.
You hear a lot of eating stories? Do they ever say, hey, are you sure I'm ready to go? I can eat this?
Yeah,
or are they ever afraid?
They do come in with some anxiety at first, like, oh, can this really be done? But by the end, they get confidence as they go. They're like, oh my gosh, this is really working.
Now, I interviewed your partner, Dr. Stubbs, and he says that people come in like the husband goes first, like the guinea pig, and then the wife comes in, or vice versa.
We see it a lot. Yeah, they send usually it's the husband that goes first. He's the brave, tough one,
Okay.
And he goes in and he does it, and then the wife follows up and she has hers done too. And it's great.
You and I have talked. When you plan your retirement, you're not planning going on cruises in a denture.
No, you're not thinking about that when you're 20, 30, 40 years old. It kind of creeps up into our lives. Like I said, these people, they've been putting everybody first, and then these things are happening behind the scenes. So it's a great reward when we can do something for them that fulfills their life. It does. But they all have regrets.
What's that?
The regrets are they didn't do this sooner, or they didn't get something done to take care of this sooner. Yeah.
That's good. Now, I know a couple denture wearers. They never complain. Are you saying there's no such thing as a happy denture wearer?
Randy, they're not going to complain to you. You're not their dentist.
Okay, good point. Okay.
They're either family or friends, and when you talk to when you complain to your friends about your teeth, you just don't. It's usually they're coming to me, and they're complaining to me about things are hurting, they're getting denture sores, things aren't fitting correctly, they're rocking around, they're like socks on a rooster, they kind of flop around, and so it doesn't have to be that way.
So there's thousands and thousands of people in Utah that are either headed to a denture, currently wearing a denture.
Yeah, they're there.
But for whatever reason,
I think they just feel like
they're just afraid. I guess
it's either fear or they just feel like this is what there is for them. They just don't understand that there's something better out there.
You say they usually have hated their teeth for like 10, 15 or more years before they do something.
Yeah.
So the challenge is what? Getting them in early?
Just getting them in. Helping them know that it can be done for them too. It's not just the other guy, it's for them as well. Let me show you this next patient.
All right.
Here's what I love about this guy. He's actually a pretty young guy. And he just wasn't happy with his smile. If you look at him, he's hiding his smile.
Okay.
Because it's hid behind a beard or whatever, because he's just embarrassed. He's a guy that wants to get out. He wants to be with his friends. He's interacting and meeting people. And so he came to us like desperate, like, what can be done for me? He had been to other places. His options were a denture. And we knew that we could do better for him. And so we were able to.
So that's how they come to you, right? Yeah. They Google it. I mean, they know you guys as the people that give new teeth.
Yeah, they've done their research a lot of times, or they've just heard from a friend. We get a lot of referrals from other people that have done it, and so they kind of find out that, okay, these are the guys that if it's a last-ditch effort, they can help us. Okay. And so they come to us.
So with this guy, he looks good in that after.
He looks great, and he's a really good guy, and he's happy and he's living his life, and that's what I want to provide for them. Is I don't want them to think about their teeth anymore. I don't want them to be hiding their smile.
Can you spot that? Like you're in Utah and you could tell who's hiding their smile?
From 20 yards away, you can spot
really?
it. Yeah. I mean, we use a smile in our society. It just means a lot. It kind of shows a vulnerability, or it also shows kind of an approachableness.
Okay.
It just makes you more of a person that, you want to be around that person that's smiling. And so when they're hiding their smile, you just can't help but notice.
So when they get this done, they're all done.
Yeah.
You say they come in like a little bit of a skip in their step. They're not even saying, like sometimes your assistants. I think you told me this in the agreement.
Oh, yeah.
That they got to say, that's so-and-so.
Yeah.
It's hard for you to even recognize.
It's hard to even imagine that their personality has changed.
Because I always think it's just teeth, but when I look at photos like this, it's more than that, right?
It's more than that. I've got patients that they've been runners their whole life, and they get kind of debilitated by pain. That something breaks in their mouth, and they're just having all these dental problems, and it kind of handicaps that part of their life.
Okay.
And we've been able to get them back on track so they can just live their life again. They're back running, they're back mountain biking, they're running, marathons and doing bike races.
It's like those commercials of the guy that get the hair.
Yeah.
They start running and hiking and dating. It's the same kind of thing. Seriously.
Same kind of thing. Yeah. I mean, Randy, look, don't take it from me. I mean, I'm a dentist, so if you're going to ask me how important is a smile,
okay,
you're a dentist. Of course you think it's important, but statistically, look at the studies. The smile is usually the top 3 things that people look at when they're meeting a person.
Okay.
The eyes and the smile. Those are the things that kind of make you kind of more welcoming and more approachable.
We are almost out of time, like 3 minutes left, and you still have a stack of photos, so I'm going to rush you.
Okay.
Let's go through all of them.
Let's go through them. Okay. This gentleman here. Again, wow. He had been other places. The option for him was denture or really, extensive work that just wasn't of an interest to him. And so once again, we were able to put him into something that was permanent.
Like one morning, one afternoon?
Yeah, one morning. So he came in, we did the consultation. Once we get all the preliminary stuff done, the day of surgery, he was actually able to walk out with teeth.
Okay, if you had an opening, somebody watching right now with really bad teeth or a denture, in a few days from now, they could have their upper and lower teeth that don't come out. If you have openings.
If we have openings, it could happen.
Is that right?
Yeah, it could happen. Okay, so Randy, look at this photo, the before and after. This gentleman, he had gone that way for a long time. This just does not happen overnight. This takes a long time to get to this
point. 10 years or something?
10, 15, 20 years. And in one afternoon, we were able to get him to this position where he was able to have his permanent teeth in there without any trouble.
Do you hear a lot about steaks? Do people like to eat juicy steaks?
Yeah, absolutely. Steaks, carrots, cucumbers, you name it.
Because salads, right?
Yeah, salads
are tough to eat.
It's really hard to eat with
almost
a denture.
Impossible.
It's really hard with a denture. Think about it. You're talking about lettuce, cucumbers, carrots. Those things are hard to get through. And if you've got something in your mouth that's moving, and you go to bite on something hard, it's going to dislodge and it's going to be painful. Okay. So the nice thing about the all-on-4, the implant route, is it's on there stable. It doesn't come off. Okay. Here's the next one. This is one of my favorites.
Oh, wow.
So this gentleman, just a nice guy. You know, you can see here we've got missing teeth. And the beauty of this, if you looked, he had some work done here before. On those front teeth, someone had put some crowns and they were too long. And so we were able to get him in something that actually fit his face better. And, you know.
And this is all done on a computer. I mean, you guys do this.
This is all done digitally now. So there was a time when we did it with, you know, we would kind of eyeball it, but now we're able to do it with a computer. And
I mean, you have like mills, dental mills, printers. I mean, digital printers that make the teeth in the other room.
Yeah, so it's all done digitally, and it's done on a printer. Yeah.
It's all pre-planned on a computer, like the surgery.
Yep, all of it's done ahead of time. Yeah. So it's pretty cool. It's,
I'm going to rush you. We're going to get through every one of these.
All right. This is one of them. This is a really good one. So this gentleman, again, he was tired of the appearance of his teeth. In fact, with him, he came in and I thought, when I first met him, I thought, oh, this is really pretty serious guy. Once we finished his teeth, he just lit up. Okay. Now he just kind of floats in and he's just super happy and he's really sarcastic and funny. We've got a great relationship. You know, we talk about skiing and going to the lake house.
He's another one that would have been wearing a denture.
He would have been in a denture, yeah.
Okay.
Yeah. He was just at the point where something drastic had to be done. This is a really good one. Again.
Wow,
young. A mom who had put everything first. If she would have gone anywhere else, she would have been in a denture. That's what she was told. And we were able to get her into some teeth that didn't have to come out. They stay in her mouth.
Looks good.
Yeah, and it fits her fantastically. Here's a nice gentleman. Here's a guy, he came in, he was told he was going to need a denture. He absolutely did not want a denture.
Do they ever tell you that on the consult?
Oh,
like,
absolutely.
I don't want a denture.
I don't want a denture. They're deathly fearful of a denture. And it's true because they shouldn't have to be in a denture. And we were able to get him in something that really fit him nicely.
Looks good.
Yeah, they look good. All right. Oh, here's one. This one, surprisingly young.
Wow.
And he was told, and he would have been in any other office, he would have been a denture. Because of the infection that he had going on in his gums, the bleeding and the infection and the abscessing that he had going on. But we were able to get him into some permanent teeth. All right. You can see with this nice lady, she had lots of gum disease. There was a lot of things going on that she was heading into a denture. That was really the last leg, but she did not want a denture whatsoever. So we were able to put her into some teeth that did not come out. All right, Randy, look at this before and after. Okay. If you look at her after, she's not used to smiling. She's been hiding her smile for so long, she's just not used to it. After about 2 months of compliments, she'll light right up. It's great to see, and she does. When she comes in the office, she lights up like a Christmas tree. It's fantastic.
Now we're out of time. So somebody watching this, they've heard what you had to say. Yeah. They've either have the bleeding gums, the bad breath, the loose teeth, bad teeth that have to come out.
Yeah.
Or the denture wearer is watching this. They've heard you, but they're still skeptical. What do you say to them?
Come in. Let us show you how it can be done. How we can get you into something that does not have to come out, that doesn't have to rock around, cause denture sores, and where you have to live that way in your life anymore. It doesn't have to be that way.
All right. I want to thank you for coming on the show.
Thanks
always a pleasure having you on the show. Good stuff. Good stuff.
All right.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.